My name is Terra Branson. I'm the Acting Secretary of the Nation in Commerce, and I've been tasked to deploy the coronavirus relief funds that the Muscogee Creek Nation received. The Muscogee Creek Nation started working on the coronavirus relief fund and coronavirus funds generally when the CARES Act passed March 27th. We started tracking the legislation, agency decisions, joining phone calls, submitting comments. We actually did submit comments specifically to Treasury on the distribution of the coronavirus relief fund. So we made those comments at the end, just before they opened the certification. So the certification opened with a data request on April 13th. We worked with our informal team to gather that data and submit it by April 16th. The deadline was on the 17th, so we're all working under tight timelines here. And then kind of waited for Treasury to make a decision. So in the meantime, we didn't meet as often. But when we got notification from Treasury at the end of April that they were going to distribute funds, we started kind of engaging in conversations again. We actually did receive our disbursement on May 5th of $282.2 million, which is a historic distribution to tribes, something that we have to take very seriously as we move forward. We want to make sure that we're making good decisions, not just for our government, for every tribal government, because any decision that a large tribe like ours makes could have an impact anywhere in Indian country, and so we want to make sure we're making the best decisions possible. Once we received the distribution and kind of confirmed the amount, because we wanted to make sure that it was really ours and this was the number, we started meeting pretty much weekly, if not bi-weekly. So our first meeting was on May 7th. That team was a little bit smaller, the same team that put together the data for the certification. So kind of just talking, bouncing around ideas. There was lots of discussion about guidance and what was allowable and what wasn't allowable. In the meantime, Treasury did send out some guidelines and some FAQs, so we were using that as kind of the boundaries. And since then, the team has grown to incorporate more voices, more perspectives, including National Council members. So we added them recently, asked them to participate, provide ideas. They really understand what citizens are experiencing, and we hope that they'll bring that to the group so that we can tailor programs and services that work with what people need here, not just in Oklahoma, but our at-large citizens as well. They are eligible for funding, so we can provide support to them. So we're trying to figure out the best way to deliver those within the boundaries, not only of the CARES Act, but of Creek Nation law and federal guidelines and requirements under the Uniform Code. So the CARES Act does have some broad rules, and then there's some guidance and FAQs that they provided, as I mentioned. I just kind of want to go over the three rules from the CARES Act. The first one is really that the expenditures were necessary as a result of the public health emergency. There's a lot of ways to get to that, to meet that need and to identify that as a responsibility. So we have a rule in place how to do that. The second really is that the expenses can't be accounted for in our most recent budget. So we've had lots of discussions about what that means, how we're going to operate it, how we define that, and how we're going to account for expenses that we've incurred. The final one is really that the expenses have to be accounted for between March 1st and December 30th. That's a very tight timeline for any government, especially a tribal government, and so we are working as efficiently as possible to make decisions and get something in front of leadership to consider so that we can mobilize the funding as quickly as possible. The Creek Nation team that's working on the deployment has had a lot of discussions about the best way to provide services to individual citizens. We've vetted a lot of different ideas. One of them is what tribes are calling a per capita payment. We know that tribes have gone on the record saying that that's their intention, their intended use for their CRF funding. The concern for us is that it really hasn't been verified anywhere that that's an allowable use. While the federal government did that in the CARES Act, and some people have benefited from that, and we appreciate those opportunities, it's not something that we're real sure is allowable right now. So as a team, we're continuing to vet the idea. We're continuing to consider how we can best support the people who need it the most. We have 90,000 citizens we have to provide services to, so we just have to be mindful that that's really the best choice for everybody involved.